The school's vision is to provide primary care to rural and underserved areas. A lot of people coming from underserved areas and minorities tend to want to go back to those areas, but they also tend to be the kids that don't come from the affluent families. Anything we can do to try to encourage a student to consider primary care, and then beyond that, if you would consider primary care in an underserved community.
Yeah, I grew up in West Texas, a small town, literally a one-stoplight town on Route 66. Two healthcare providers we had in town were the local pharmacist and the school nurse, who drove 20 miles each day from another town to serve the schools. So to get access to a physician was a 30-mile drive in two different directions we could go.
My three siblings ahead of me, and then I were first-generation college kids. I didn't have any role model for becoming a physician, let alone going into healthcare. Nobody in my family had been in healthcare. That was our mission with the scholarship, to try to lighten the financial burden a little bit, to make it a little bit easier for somebody to think about. Go into a field where the salary's not going to be as high.
If a student amasses a medical school debt of $200,000 plus, most of that's going to have to be financed through loan programs. We don't have enough scholarships to begin to offset that level of debt. In this instance, PNWU is very, very young at building scholarship endowments, and we're very young at trying to help students find their way to offset that cost.
Physicians' incomes, primary care incomes, have not kept pace with our cost of living over the years. And so today's student is going to graduate with probably about 4.5 times the debt I had. But their income going into internal medicine or family medicine is not 4.5 times what I earned. I can't even begin to think how long it's going to take today's grads to pay off $200,000.
But if you go back and look at offsetting even $5,000 or $10,000 of that initial debt, over the course of a 10 or 20 year loan payback period, the interest alone that scholarship saved is really impressive. And we need to try to find as many ways for students to financially complete their education as we can.
You don't know, if the student you're helping is going to wind up in a small community and changing somebody's life. There are many rural communities right now who don't have a doctor. These hundreds of students that are now coming back to the Northwest, these communities that didn't have docs, who maybe only had one very overworked doc, now have doctors for decades to come. And that domino effect of what's going to happen as we start planting new grads all over the Northwest is yet to be seen.